is 1:30 p.m. and I'm the MCs for today for this CME talk. My name is Angels, and we will dive deep into urine incontinence and urine frequency. So how to detect danger signs. So this is very interesting. So hi, Dr. Chong Kian Tai.
Hey,
Okay.
hello, Angels.
Yes, good afternoon. And everybody is waiting for you. So I will just hand over the stage to you.
Thank you, Angels. Thank you, everyone who joined us for the CME talk, which we host once a month. And let me share my slides. I'm a urologist and I work in Surgi-TEN Specialists in Farrer Park. Today's talk is on urine incontinence and urine frequency because we do see patients with problem when they have to go toilet very often, and sometimes they leak in their underwear, and this is actually embarrassing for them. But the key talk today is not how to treat it, but actually how to detect danger signs so that in the GP clinic, you can advise your patients. These are my panel insurance, which I'm the main panel doctor for all these integrated shield plans for patients who need to have a cover for insurance as a main panel doctor. Today's topic is going to be on what is normal urine frequency. When we know what's normal, we know what's abnormal. Then we talk about the important causes of frequent urination, and then important causes of urine leakage. And the more important is when do they need to see a specialist. Normal urine frequency in the daytime ranges between 5 to 7 times usually, and every 2 to 4 hours, unless your boss don't let you go toilet when you're working. Then of course that's different. But how about the nighttime? Most of us, majority of the people, even in older age group, should not go to toilet more than one time. You should be sleeping throughout the night for good night's sleep, or at most one time. Anything more than one time, we call it nocturia, and it can be because of many causes, including the enlarged prostate in men. So normal is one time or less. Just remember, nighttime, some people actually cannot sleep and they go and watch Netflix all the time and go toilet during the intermission, for example. So that's not considered as a nighttime urine abnormality. It's just because they have insomnia. All right. So remember, nocturia means you wake up from sleep to go to toilet more than one time a night. And of course, we know the male and female urinary system is divided into upper tract and lower tract. The most common causes of frequent urination can be seen here. This is a summary from Cleveland Clinic. Medical conditions like diabetes, those on medication, urinary tract bladder symptoms can also have it. For men, the key point is enlarged prostate tend to cause urine frequency. And for the ladies who are pregnant, also this can cause urine frequency when they have a fetus compressing down onto the bladder. So what are the important causes then? This is an important slide for us to remember, especially when you see patients for the first time in a GP clinic, depending on whether they are young or old. If they are young, the more common causes for frequent urination is urine infection, which you can see all the time, pregnancy, or it could simply be overactive bladder when patients do not have UTI. It's simply an overactivity. And for men, the different things is we have to look for prostate infection, especially prostatitis. And they happen in many men younger than 50 years old because they find that it's a vague symptoms and prostatitis do not have a classic presentation. But as a GP and as a urologist, I need to suspect it when they come frequently for urination. How about those in a middle age? UTI is still the most common. And other than that, medication, for example, laxative, urine diuretics can cause it. And more important for urology is bladder stones and bladder cancer can cause the same symptom as UTI and may be misdiagnosed if we do not find out whether they have this condition. For men, BPH and prostate cancer can also mimic urine tract infection and urine frequency. So this is something important when we see male patients. So what's BPH? We all know that big prostate happens from middle age onwards, where it compresses the bladder outlet. And the general symptoms and signs, which we all know, is weak urine stream, sometimes going to toilet often, and even dribble after you go to toilet. And many patients do have urgency and they want to run to toilet. And when they can't reach toilet in time, they actually have a urine leakage. Or sometimes they cannot empty the bladder. They will have this thing called overflow incontinence, where the bladder is full and the urine just tend to drip out slowly, bit by bit, causing urine leakage. And of course, patients who wake up at night more than one time at night may have enlarged prostate from BPH. What happens if the bladder doesn't empty completely? We all know this because if you don't empty completely, the bladder still has remaining residual urine and has higher chance of urine tract infection, can develop stones anywhere in the bladder to the urinary tract, and eventually patient can have renal failure because the kidney and the bladder urine system cannot empty completely. These are the standard BPH treatment in Singapore, which we know. The two simple medication that you give every day in the GP clinic is either to relax the prostate or to reduce the size of prostate. Of course, when the patients come to a surgeon, we will also choose other options like resection of prostate. And you can either use a traditional resection, you can use a laser, you can use enucleation, and all these techniques simply remove the part of the prostate using resection. And of course, because of the side effect of TURP, many patients prefer to do a day surgery treatment like ProLift, Resume, or Urolift. That's because many men, even in the younger age or middle age, may still want to have sexual intercourse. And doing the day surgery procedure preserve their sexual function, normal erection, doesn't cause urine leakage as well. So I'm going to go through some of this issue with the bladder as well. Remember, other than BPH, other problem that can cause urination frequently is bladder problems. For example, patients with bladder stone, like the picture on the left-hand side, patients only come to me because they go frequently. They don't have pain or discomfort. And sometimes when they come to me, they will have microscopic blood in urine, but they have no other symptoms other than frequent urination. If you look at the middle picture and the right picture, these are all my patients who have bladder cancer. They also present with frequent urination and sometimes microscopic blood in the urine. They also, on and off, may have blood in the toilet. That's too late a symptom, but usually they present with microscopic hematuria or frequent UTI. What is special to know about bladder cancer? Well, we know that in the cancer statistics from Singapore Cancer Registry, more and more patients are getting cancer younger. And we know that the earlier cancer diagnosis is better. The leading causes of cancer in Singapore for men is prostate. Prostate is #1 common cancer in Singapore, and it is much more than colorectal and lung cancers. For female, of course, we know breast cancer is #1. The next thing we want to talk about is what are the important causes of urine incontinence that leak onto the underwear. There are 4 different kinds of urine incontinence that we know. #1 is called overflow, where patient has a full bladder and it keeps dribbling out because it's like a cup that's already full. You keep pouring water in, the water just leaks out from your cup. So it's called overflowing. Second, incontinence is actually only when patients have some form of stressful events like sneezing, coughing, or they do exercises, then this comes up because the pelvic floor muscle cannot control the urine. The third kind is called urge incontinence, where patients feel very urgent. They have to go to toilet. If not, they will leak out. And before they make it to the toilet, it actually leaks out. So it comes with urgency and incontinence. Of course, there's a last group that has a combination of all the different 3 types that's there. So to a urologist, the more important thing in the GP clinic is to decide whether a patient is overflowing or they have urgency. Just ask them, are you able to empty your bladder? If you feel that you can't, does it dribble out slowly when you leave the toilet? And the other question will be for urge incontinence. Do you feel urgency? Do you have to run to toilet often? Does it affect your work, your lifestyle? When you go shopping, must you always look out for where the toilet is? That is a sign that they have urgency as well. Why is it important? Because if a patient may have overflow incontinence, these are 3 possible reasons. They may have an underlying disease like diabetes that can cause it, with diabetic neuropathy, stroke, And also, even enlarged prostate can cause patients to have overflow incontinence. How about urgency? When they have urgent and they have to run to toilet, the condition that we look for is either they have a urine tract infection or they may have an underlying overactive bladder. Why is overactive bladder important? That's because when patients have overactive bladder, OAB, they actually have urine urgency and sometimes they leak and they have frequent urination. So it's a combination of urgent urine, leaking, and frequent. But to diagnose a person with overactive bladder, we must make sure there's no other causes. For example, we must rule out UTI, we must rule out bladder cancer, we must rule out bladder stone. To say someone really have overactive bladder, you must rule out all the other pathological diseases first before you say someone has OAB. Once you diagnose someone as OAB, there are a few things we do. Number one, we want to know in a clinic, urology clinic, we ask them how often do they go toilet, because we want to improve their quality of life. We want to know how much urine comes out, and we want to know how to treat them. So a bladder diary and OAB questions are some things we can actually ask the patient to do. How to treat urine incontinence? There are so many types of incontinence depending on the disease. Is it an urge? Is it overflow? Is it a stress incontinence? So the first thing is, this is an important slide where we tell them you have to change your lifestyle when they are doing the reduce the amount of fluid intake. And then after that, you can actually reduce coffee, tea, or anything that increases your urine production. Second, we actually train the bladder in a way that we tell patients to delay going to toilet to train the muscles of the bladder to hold more. Third, there are medications. And fourth, surgery. But more importantly is that there are actually injections that can immediately relieve the patient. So let me go through medication and injections for urine incontinence. One of the newer medication, I'm sure you may use many other types of medication for urine leak. And the new type is called Pepmiga, which is mirabagan. It is a first beta-3 adrenal receptor agonist to treat overactive bladder. Overall, it simply relax the muscle, and the muscles of the bladder do not sense the urine so quickly. And the good news is this medicine can be used in patients with BPH, older men, and it does not slow down their emptying of the bladder. So that's a good thing, because patients can still continue to pass urine even if they have BPH. So many urologists use this together with a alpha blocker or for their BPH. How about the other thing? If all else fails, we actually inject Botox into the bladder. So this is the same Botox the plastic surgeons or aesthetic doctors use on the face. We actually inject Botox into the bladder to paralyze the bladder muscles, so it doesn't have so much urgency. But you must do it only after ruling out UTI, bladder stone, bladder cancer. And remember, just like the face, the Botox lasts only 6 months. And after 6 months, they will need another injection if they decide to have Botox. But the good news is it works all the time, maybe 99% of the time. And I tell patients they have a good quality of life for 6 months without urine incontinence and urgency. So with that, I want to conclude here to know when to refer to urologists. This is the slide that's important for you to have a look. Maybe you want to take a picture of it. And these are the 3 main places where you want to refer to urologists. For female, if a female has 2 times or more UTI within 6 months, we suggest that they see a urologist to make sure they don't have bladder cancer, other anatomical changes, bladder stone, or other things. And for any men should not get urine tract infection. This is something we have learned in medical school, because it is unusual for any man to have UTI. We have to look for anatomical changes, stones, or other causes. So that's why a urologist need to search. How about the other category of patients who need to see urologists? The other one is urine leak. If your patient has overflow incontinence, we will have to search whether patient has enlarged prostate or other medical condition, because they are not able to empty the bladder and bladder is overflowing with urine leaking. Second thing is urge incontinence, And it could always mean that patient has overactive bladder. We have to do a cystoscope to make sure they have no bladder lesions or bladder tumors, especially carcinoma in situ of bladder can mimic UTI, especially in women. Then how about patients who have urine frequency? If the patient is affected by it, affects quality of life, and also has microscopic hematuria frequently with it, we have to rule out UTI, overactive bladder, bladder stone, and bladder cancer. So this is a summary slides of when patients should be seeing a urologist. At the end of my consultation with my patients, when they are distressed by their urine leakage or incontinence or urgency, I always ask them, do you want to be happier? So this is something I do with my patients. That's because when we look at a Harvard study, actually in Harvard, they did one of the longest study on happiness since 1938, when most of us were not born. And they actually studied this for 75 years in Harvard. What they found, and Professor Robert Waldinger, the fourth director of study, said they only found that good relationships will lead to health and happiness. So sometimes after discussing and counseling patients, their urine urgency goes away. They are not so stressed anymore. And actually, the next time they come, their urine leakage also doesn't happen. I'm not sure whether it's a placebo effect, but when patients have less stress, sometimes the urine urgency may actually get less. If you have time, just watch a video from Professor Robert Waldinger, simply titled What Makes a Good Life When You're Free. I also tell patients to smile, self-care, look after themselves, make more friends, have inner peace, love others, and exercise. Whenever they have take these principles in life, their urgency and actually resolve a lot of them. I'm not sure why. Maybe it's just inner self and placebo effect. But patients get happier, they have more friends, and they enjoy life. So we know psychology plays a part in all our patients' healthcare as well. So which is why a group of us started this program called Dr. Heals in Chiang Mai, so that we can reduce stress and reduce burnout. If you have a chance and your patients find useful, contact us and then go to the website for more information called drheals.com. The other one is that we don't want to have fake news and we like to see proper doctors giving proper medical advice. We started asiamd.com website, similar to WebMD. Some of you may have seen the US style, so that we can provide healthcare articles and wellness updates. And they are in different languages too. So that's asiamd.com. With that, I thank you very much and God bless. And thank you for spending your lunchtime with us. And if you have any questions, please ask me or email me if you want my slides. Just email me anytime and I'll just send you my slides. Thank you very much.
Thank you, Dr. Chong. Okay, so because you wanted them to email you, right? So maybe you can also share your email address.
Yeah, is my email, can you see the email on the picture on my slide?
No. Oh, yes, yes. Okay,
Yes,
okay.
yeah.
Sorry,
Yeah, my
because I
email is
changed
there.
to the other screen. Okay,
Sure.
so thank you for sharing. And then we have one person's questions from Grace Su. How common are kidney stones and what causes kidney stones? How to prevent them and what is the treatment?
Hi, Grace. Thanks for joining in. The kidney stones is pretty common in the tropical countries. Number one is because we tend to drink less water and when there's a humidity and hot weather. So water intake is important because even if someone forms a small crystals in the kidney, if you can flush it out, it does not become stone in the future. So drink more water, number one. Secondly, there are many food that has increase in oxalate or calcium content that can cause higher chance of kidney stones. So I will always tell patients to Google what it looks like, and when they see the whole list and get scared, I tell them, don't worry, you can still eat them, but please eat in moderation. So some of the common things include tofu, some of the common vegetables like spinach causes a lot of stone, some of the nuts like peanuts cause a lot of stone, and a meat product like mutton, beef, pork, red meat also can cause stones. So there are some food that we love that will cause stones. Just remember, drink more water and eat food that cause stones only in moderation.
Okay, I also eat a lot of spinach and meat.
They are all
But
my
I
favorite.
drink
Yeah.
very little water. Yes, I need to improve. And also, most importantly, what Dr. Chong mentioned just now is to stay positive and stay happy. It's
Yes.
very important. And thank you, Dr. Chong, for today.
Thank you, Angel. Thank you, everyone, and see you soon. Thank you. Bye.
Bye.